This is Vermont Edition. I'm Michaela Lafrac. As we enter cold and flu season, more people are heading to their doctors and pharmacies to get their shots. Flu, yes, and also COVID. But unlike last year and the year before, getting a COVID vaccine is no longer a straightforward process. The CDC, the Centers for Disease Control and Prevention, is in a period of major upheaval. Health Secretary Robert F. Kennedy Jr. recently fired the CDC director, just a month after she was confirmed to her position. And he also fired the members of the CDC's immunization panel. The new panel hasn't met in weeks. This panel essentially advises the CDC director on who should get vaccines. The director's guidance then becomes official U.S. policy, and that's what insurers look at when they're deciding what vaccines to cover. Here's the policy right now, according to the Food and Drug Administration. You're approved to get the updated COVID-19 vaccine if you're 65 or older or have a health condition that makes you at severe risk of infection. If you aren't in one of those groups, you might need a doctor's prescription to get a shot or pay out of pocket. And all this really depends on what state you're in. CVS and Walgreens are already adhering to these new rules and restrictions. Recently, my colleague, the political reporter Bob Kinzel, spoke with Vermont's senior senator, Bernie Sanders, about all of this. He's the ranking member of the Senate Committee on Health, Education, Labor, and Pensions. And they discussed Robert F. Kennedy Jr.'s leadership, as well as the COVID vaccine. Let's listen to what the senator said.
Are you concerned that Health and Human Services Secretary Robert F. Kennedy Jr. is trying to restrict people's access to the new COVID vaccine?
I am. It goes beyond that, Bob. You have a guy who literally, through his nonprofit organization, made millions of dollars on an anti-vaccine crusade, and this is incredibly dangerous. Vaccines. And this is not my view, this is the view of doctors and scientists all over the world, vaccines have been one of the great advances in public health, wiped out or came close to wiping out diseases like polio, smallpox, measles, and other diseases. And then you have a Secretary of Health and Human Services who is essentially casting doubt on the efficacy of vaccines is extremely dangerous. When I was chairman of the Health, Education, and Labor Committee, I had before the committee all of the people heading government agencies whose job it was to help us prepare for the next pandemic. And without exception, they said, we don't know when it's going to happen. There will be another pandemic. So what we should be doing right now is doing the research that will put us in better shape than we were when COVID hit us. That's what we should be doing, not having somebody involved in conspiracy theories, bringing forth phony studies, but depending on the scientists and the doctors who actually know how to keep us healthy. So to me, what Kennedy is doing is very, very dangerous.
Did I see recently that you felt that he should resign?
Absolutely. Of course he should. And the irony here, and as I'm sure Vermonters know, I'm not a great fan of Donald Trump, but, when Trump was president, he really did a poor job initially in dealing with COVID. And he downplayed, as many will remember, he downplayed the seriousness of the growing pandemic. But to his credit, once I think he understood what a crisis we were facing, he put together what he called Operation Warp Speed, which was an effort to get the drug companies to move very aggressively to come up with a COVID vaccine. And in fact, that happened. In kind of record-breaking time, they came up with vaccines, and these vaccines saved millions and millions of lives, not only in our country, but around the world. And he himself, Trump said the usual with his pop, this is great, all that. Well, he deserves credit for that. And then you have now a Secretary of Health and Human Services who is really casting doubt on the effectiveness of these vaccines. This is very dangerous, Bob. It's dangerous for our kids today. And it's certainly dangerous in terms of how well we will be prepared for a future pandemic.
That was Vermont Senator Bernie Sanders, an independent, speaking with Vermont Public's senior political reporter Bob Kinzel. Now, later in the hour, we're going to talk with a local infectious disease doctor and the head of Vermont's Department of Health. But first, for additional context on what exactly is going on at the CDC, we are joined by Ann Schuchat. She's a former principal deputy director and former acting director at the CDC who stepped down in 2021. She's also an internist and an epidemiologist, and she currently serves on the board of Gavi. It's an international organization focused on vaccinations for children. She recently co-authored an op-ed piece in the New York Times with other former CDC directors condemning Robert F. Kennedy Jr.'s recent firing of the CDC director. Welcome to Vermont Edition, Ann.
Thank you so much.
Now, I want to start by talking about this contentious Senate hearing that Health Secretary Robert F. Kennedy Jr. had on Thursday of last week. The focus was on changing vaccine policies and some recent high-profile firings and resignations at the CDC. Here's part of what the health secretary said.
We were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they'd prevent infection. It wasn't true.
We were lied to, he said. Now, you were a deputy director at the CDC at the height of the pandemic. In your opinion, are his claims true?
That hearing was absolutely shocking. The rudeness, the lies, the hostility towards the senators was really a sign that this man should not be in charge of a major department. He cherry picks information and denies his own previous comments. It was just absolutely stunning to watch his performance there. And if people were not skeptical of his competence, I think after watching him, you would be.
I have to say, I watched that hearing, and it was it raised my blood pressure at every single minute. It was frankly hard for me to trace reliable facts from anyone, be it RFK Jr. or Democratic or Republican senators. How can the average American know which health officials to trust at this point?
It's a really confusing time for people, and I am so sorry that the average American has to go through this right now. Whether you're trying to find a vaccine at the pharmacy that was able to give you a vaccine last year and suddenly can't. The attacks on CDC, the attacks on the pediatric professionals, the attacks on public health make it very difficult for individuals. What I can tell you is that in the face of all of the attacks and destruction on the CDC, other entities are stepping up. So if you have children, I would follow what the American Academy of Pediatrics is recommending. They've done a thoughtful review of the evidence and came out with their own recommendations for respiratory season because of the attacks on the CDC's process. It used to be that the Advisory Committee on Immunization Practices at the CDC was really the gold standard. The American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and most other professional organizations harmonized with the CDC's ACIP. This year, the 17 members of the ACIP were summarily fired by the secretary, and 7 individuals with dubious qualifications were appointed. They did not post or share the information they were reviewing ahead of the meeting, and they basically rammed through some questionable recommendations back in June. So I think the average American, if you have children, I would follow the American Academy of Pediatrics. If you are pregnant, I would look to the American College of Obstetricians and Gynecologists. The Vaccine Integrity Project out of Minnesota is doing some very thoughtful, careful evidence reviews and sharing them with the health professional organizations. But it's a terrible time right now because certainly the ability for the CDC to make evidence-based recommendations free of ideology is quite questionable right now.
We're speaking with Dr. Ann Schuchat, a former principal deputy director and acting director at CDC. You can call in with your thoughts and questions about what is going on with public health at the federal or the state level by emailing Vermont Edition at vermontpublic.org or by calling 800-639-2211. Now, Dr. Schuchat, we got an email from a listener named Maria who's in Brattleboro. And she writes, I am very grateful that here in America, we had the COVID vaccines available to us free of charge and so early in the pandemic. I believe that saved many lives. This fall, I will have my COVID vaccine again, hopefully free of charge. I don't believe what Mr. Kennedy says, and I do trust the scientific community. I want to talk about that free of charge part of this email. I think a lot of Americans, myself included, until I was doing a lot of reading before today's show, don't quite understand the role CDC recommendations play in whether or not you're going to have to pay for a vaccine when you go to your doctor or walk into Walgreens or CVS or your local pharmacy. Can you explain that connection for us?
Yeah, the CDC is right in the middle of what insurers do. Since 1994, CDC has overseen the Vaccines for Children program, which provides vaccines for free to children who are not insured or who are not insured for vaccines. And so since 1994, about half of the pediatric population, about half of the young children in the country have gotten their vaccines for free from their doctor or their nurse, their pharmacist, through that VFC program. With the Affordable Care Act, CDC's Advisory Committee on Immunization Practices became the gold standard, essentially, for insurers, for others, for adults, for anyone getting vaccines. If the ACIP recommended a vaccine for routine use and put it on the schedule, then insurers have to provide it with no copays or deductibles. A few little footnotes like it needed to be given in an in-network provider. But that meant that these cost-effective, life-saving vaccines that were recommended by the CDC's Advisory Committee on Immunization Practices would translate into essentially insurance coverage. Now this is all a question. And certainly the COVID confusion between the FDA and the destruction of the CDC's ACIP has meant that if you, as recently as yesterday, when I asked at a few different pharmacies and stores in my neighborhood, no, we don't have the vaccine. No, you have to get a prescription. Doesn't matter if you're over 65, which is a routine recommendation. You're not going to be able to get it without a prescription. So that's just totally chaos compared to a year ago.
Yeah. So as we've mentioned, the FDA has limited approval for the newest COVID vaccines to adults who are 65 and older or at high risk for severe disease. During this Senate hearing that we're talking about with Health Secretary Robert F. Kennedy Jr., I noticed that the New Hampshire Senator Maggie Hassan, who's a Democrat, was really grilling Kennedy about these new restrictions. And he's responded by saying that the federal government has not collected data from clinical studies showing that these vaccines are safe and effective for kids in particular. Senator Hassan from New Hampshire strongly disagreed with him on that point about whether or not kids should be able to readily access COVID vaccines. What are your thoughts on that area?
Yeah, the secretary just makes things up. So basically, part of what the pediatrics organization, the American Academy of Pediatrics, reviewed was all of the evidence about vaccine performance. Now, there are studies done before vaccines are approved by the FDA or get emergency use authorization. And then there's large studies that are done after vaccines go into widespread use. There is more data on the safety of the COVID vaccines than on any other vaccine because billions of people have gotten those vaccines. And there were some very careful safety studies done before and then after. So the information that the secretary was spouting was just not true.
Well, speaking of New Hampshire, we have Michael calling in from Chesterfield, New Hampshire. Michael, go ahead.
Hi. My concern, can you hear me?
Yes, we can.
My concern is that no senator, President Trump, has brought up the issue that Secretary Kennedy, after his father's assassination, which was a horrible event, became a heroin addict. And he became a heroin addict for a while. He also introduced his cousins to heroin. Now, he has cleaned up, but an addict is always going to be an addict, and I know that because my brother died on methadone maintenance. No one's asked Senator Kennedy if he does any maintenance like methadone. I believe that if a Democratic president had nominated a former heroin addict to be Secretary of Health and Human Services, Republicans would have been up in arms. I'm really surprised that no Republican senator, especially the two doctors, have asked Kennedy about his condition as a former heroin addict. He's untrustworthy. He makes things up. He really demonstrates what I see and what I grew up with as combative behavior of an addict.
Well, thank you, Michael, for calling in. Yes, Robert F. Kennedy Jr. has spoken openly about his past addiction to heroin and other drugs. And, as a former CDC director yourself, Dr. Schuchat, I would love your thoughts here. Do you think that being a former addict disqualifies you from holding a position like that?
I don't think that's disqualifying, but what I do think is a problem is that his very strong personal views on his own addiction and recovery have colored his ability to look at the evidence. We have a major problem in the United States with overdose deaths. We're starting to turn the corner on that. But when you look at the policies that the Secretary is implementing, and particularly concerns on cuts to Medicaid, that the impact on substance misuse and treatment and prevention is going to be very challenging. So I think that the personal behavior is one thing. The problems that I have with the Secretary are his lying, his cherry picking of data, his destruction of functional institutions. So I would put his personal history as a real footnote in terms of the concerns that I have with him.
Yeah. Well, if you have questions about what's going on at the CDC and how it might trickle down to impact you, your community, your state, give us a call at 800-639-2211. We'll hear more of your voices in just a minute on Vermont Edition. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lafrac. If you're just joining us, we are looking at the massive changes that are underway at the CDC, the Public Health Agency of the United States. Our guest is Dr. Ann Schuchat, a former principal deputy director at the CDC. She stepped down in 2021. She's also an internist and an epidemiologist. You can join the conversation as well. You can call in with your questions or your thoughts at 800-639-2211 or email vermontedition@vermontpublic.org. Dr. Schuchat, what do you think has contributed to the rise in vaccine hesitancy in recent years?
Vaccine hesitancy has been around for decades. In fact, in the one of the most famous vaccine refusers was Ben Franklin, who declined to get his child vaccinated against smallpox, and then lived to regret it because his child died of smallpox. So, vaccines have been questioned, and it's pretty natural for people to wonder about an intervention that their child is getting in particular. But what we have seen in the past couple decades is a rise in conspiracy theories around vaccines, and the internet, social media, and now highly placed political skeptics have really raised the tone. So there's been really a roller coaster of vaccine acceptance, vaccine concern, more vaccine questions, and then acceptance again. One of the factors is that vaccines that we are giving are quite effective, and so the diseases that we're preventing are much less visible. So, when in the 50s and 60s, when parents were very familiar with measles and with they knew about polio outbreaks and so forth until the mid-50s when we got vaccines. The vaccines were real lifesavers, but as we've really controlled and prevented so much disease, even pediatricians may not have seen many of the diseases. And so people will have questions about the vaccines, less about the diseases. But all you sort of need is a big outbreak for people to remember that these vaccines are really saving lives. And the terrible measles outbreak we saw this year with the highest number of cases in a couple decades was a wake-up call that these diseases come back when you don't vaccinate.
Mm-hmm. With COVID specifically, a lot of Americans are facing this choice right now where, maybe they don't have super strong opinions one way or the other about RFK or even the CDC, but they're just trying to decide if they want to go to the trouble of getting a COVID vaccine this year. And they're confused by the changing regulations. They're not totally sure if it's going to be covered by insurance. And they are worried they might feel sick for a couple days and have to miss work or something like that. I wonder if you might have any advice for somebody who's listening right now, who's wondering, do I go to the trouble of getting a COVID vaccine this year?
Yeah, if you're over 65, if you have an underlying condition like diabetes or obesity, the COVID can be very serious for you. You can be hospitalized, you can die, you can get long COVID, et cetera. And the vaccines are effective at preventing hospitalization and death, and so those severe kinds of outcomes. They're not necessarily effective at keeping you from spreading it to someone else in the family, but they can really be the difference between your being hospitalized or not. If you're otherwise healthy, what I would say is, do you want to be feeling crummy for a few days or worse? I can tell you that when my healthy non-elderly husband had COVID, spasms of cough that kept him up at night, extremely uncomfortable, fever, et cetera. And so I think that an individual will just need to make that choice. The vaccines are not 100% effective. You can still get COVID after getting the vaccine, but you're much less likely to have a severe outcome, whether you're healthy or elderly, et cetera. So, this is quite different than the MMR vaccine for young children, where absolutely everyone needs to get 2 doses of the MMR vaccine. COVID for healthy adults would be a choice, but many of us would rather not miss the important events that we're looking forward to attending. So, and also play that sort of Russian roulette of, will I get the very severe outcome or will I get long COVID?
Right. Now, with these changes at the CDC and some of these new guidelines, there is this state-by-state approach to vaccine recommendations and even availability that's emerging. We're going to talk a little bit more about Vermont's role in that specifically later in this hour. But first, I'm curious what your thoughts are coming from a national public health agency of what the effects of this kind of state-by-state approach could be in terms of the spread and containment of COVID.
Yeah, it's really unfortunate. I mean, I'm appreciate that the Western states have stepped up to pull together and come up with guidance that their practitioners can follow and hopefully simplify things for consumers. But as you know, everybody moves around and people cross state lines all the time. I wish that the CDC were able to review the evidence, be transparent about it, have advisors that were not conflicted and that were qualified to make recommendations and allow every state to get on board with that. But I understand why the Western states and perhaps the New England states are banding together, and I understand why the American Academy of Pediatrics felt compelled to issue their own guidelines. I think hopefully we're in a short-term period where the national level isn't as trusted as we used to be or hopefully will be in the future, and these other approaches are perhaps temporary, but going to be helpful to consumers. Hopefully the insurers will follow the recommendations that those groups come out with.
And many people at the CDC have resigned under the leadership of RFK Jr. Do you think that resigning, was that an appropriate choice? Would you have done the same if you were still working there?
This has just been an unprecedented time for CDC, and you have to remember the public health workforce in general and the CDC workforce in particular are very resilient, and they're used to emergencies, they're used to crises, thousands of responders to Ebola, to Zika, to the H1N1 influenza, swine flu pandemic. This is a group of workers that are pretty hardy, but they had thousands of people were laid off. They had an acting director, and not even an acting director, finally got a director, and she was fired after about 3 weeks. They had a gunman attack the headquarters with hundreds of bullets, firing right over a child care center adjacent to the campus, and a policeman was killed. That the workforce has been through all of that. And so the leaders who resigned, I think, really felt that they needed to make a statement that it was not normal to fire their Senate-approved director, who was fired because she refused to fire other people and because she refused to rubber stamp guidelines that she hadn't seen yet and that she was skeptical were going to be issued without ideological ultimatum. So I think what would I have done? What I tell my colleagues and friends who are still there is everyone needs to make a personal decision. When I was at the CDC, even during hard times, I always felt like I could do more good within than outside, and I was proud to work at the agency and to be part of the public health workforce. Lives saved, health improved, just so much impact that public health has and that CDC was able to contribute to. But I think it's really a horrible time right now, and I so appreciate the people who are still there working very hard to try to help improve the health of the American people.
Now, briefly, Dr. Schuchat, before we let you go, I'd like to get your thoughts to a comment that we just received from a listener named Britton, who says that they're a physician, strongly pro-science, but I think the backlash to vaccines is partly the result of how our health institutions have handled themselves. Long before RFK Jr., agencies like the CDC and FDA became increasingly politicized, often presenting science as dogma instead of as a process that evolves with new evidence. When guidance changes, they write, people see it as dishonesty rather than progress, and that erodes trust. Unfortunately, this credibility gap has fueled skepticism around vaccines, ironically weakening one of the most powerful tools we have in public health. What are your thoughts on that erosion of trust?
Yeah, actually, I agree with quite a bit of what the individual was saying. One of the most frustrating things for me at the CDC during the COVID pandemic was that I was not allowed to talk. So there was a certain point where I was not allowed to speak to the public, and at a certain point, I wasn't even allowed to speak to public health partners. Wow. Previously, you may remember during 2009 in the H1N1 influenza pandemic, CDC was talking all the time. We were out there, and our mantra was, we wanted to be first, we wanted to be right, but we wanted to be credible. And to be credible, we needed to be honest and open and empathetic. We needed to avoid absolutes. We need to acknowledge uncertainty and foreshadow that things would change as we learned more. In the COVID pandemic, the communication from the federal government was basically just not all of that. The rules of risk communication were broken, and we lost trust. Whichever administration was there, they lost trust, because the nuance and subtlety wasn't the message. There were lots of great local messengers, public health messengers, your neighborhood epidemiologists. There were other people who were not necessarily constrained by the politics, who were able to communicate that nuance that I think the caller is discussing. But yes, when you have a pandemic, when you have a public health emergency, things change, and you need to keep the public with you. We like to say that you want to meet people where they are, and you want to be honest and open so they can trust you. And if you don't have trust, you're not going to get anywhere. So I do think that I wouldn't probably paint it as black and white as the caller did, but I do agree with that sentiment that we need to rebuild trust. Unfortunately, vaccines has been pulled into politics in a way that we'd never seen before. We've had vaccine hesitancy, we've had vaccine concern. It's natural for people to have concerns, and clinicians and need to be able to talk to their patients and address those concerns. But once it became a political litmus test of whether you were for or against a particular vaccine, that just is not going to help the public.
Dr. Ann Schuchat is the former acting director and former principal deputy director of the CDC. Dr. Schuchat, thank you so much for your time today.
My pleasure.
Coming up, we are going to be joined by an epidemiologist from the University of Vermont, as well as the state's health department director. If you have questions about getting vaccines in our region, now is your time to call in at 800-639-2211. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lafrac. This hour, we're discussing the uncertainty around vaccine access amid firings at the CDC and Health Secretary Robert F. Kennedy's questioning of the agency's previous stances on COVID. 8 northeastern states met recently to figure out their own path forward. Vermont's interim health commissioner, Julie Arel, was at that meeting in Providence, Rhode Island. She joins us now. Welcome.
Thank you for having me.
And we're also joined by Dr. Timothy Lahey. He's an infectious disease physician and a professor of medical ethics at the University of Vermont Medical Center. Dr. Lahey, welcome back to the show.
Thanks for having me.
Julie, could you tell us more about this coalition that's coming together of northeastern states? What was that first meeting like?
The first meeting was fabulous. We didn't really get into a lot of content, but really talked about how do we want to work together? What does it mean to be a collaborative, a regional collaborative? Collaborating with other states is very common in public health. We do it all the time. We reach out. There may be certain characteristics that are similar, and so we do collaborate a lot. But taking a regional approach like this is a little bit new, and yet it makes so much sense. I'm not quite sure why we haven't done it before. Public health and public health emergencies don't stop at state lines. So having this group that really does look at the issues from a regional perspective is important. Some of the things that we are working on are trying to step into maybe where there might be some gaps. An excellent example of that is providing guidance for healthcare workers on returning to work following respiratory disease. So the CDC's guidance is out of date. And the advisory committee, known as HCPAC, and do not ask me what that stands for. HCPAC normally provides recommendations to the CDC, and then the CDC adopts them, and we all adopt them. HCPAC was disbanded in May. But we're left with outmoded recommendations from the CDC. So this group, one of the very first things that we were able to do as a group was to come up with our own recommendations using the best thinkers in the group, national resources, et cetera. And then the wonderful thing about this group is we may come up with this set of recommendations, but then each state gets to decide how they move forward with it. So right now, Massachusetts and Connecticut have already implemented those guidelines. In Vermont, we're doing it a little bit differently, and we're working with our partners in healthcare to make sure, does this make sense? Do you understand it? Are there questions? We want to make sure there's buy-in when those guidelines are ultimately produced.
Right. So this regional collaboration is now underway. Dr. Lahey, you've been working in this field of infectious disease and epidemiology for many years now. What are your thoughts on this this new path forward that Vermont is part of? How do you think it could change the landscape?
I think it's really worrisome. Clinicians rely on trustworthy references to be able to make good decisions for their patients, and the shifting sands of, who do you go to for trustworthy vaccine information that has been created by all the firings and destabilization at the CDC is undermines just good, smooth, trustworthy clinical care. I also worry about losses of patient trust where they may not know, which source of information to trust and sort of be alienated by all of the brouhaha. And that's the last thing we want. We want people to get boring, trustworthy advice from their clinicians and not have to worry about all of this.
Yeah. Are you fielding a lot of questions right now about vaccine access?
Yeah, I'm getting questions from my patients who are confused. and frankly quite worried that they're going to not be able to have access to basic medical care, vaccines. My parents and my friends are asking similar questions.
And Julie, I wonder if you're at the Department of Health, if you're also receiving a lot of these types of questions right now as people see what's happening at the national landscape and go, okay, so am I still supposed to trust you? What do you guys say?
We are getting a lot of questions via email, phone calls, on social media. People are confused, and Dr. Lahey is right. We, in public health, really like things boring. We like the predictability of normally how we move through the fall respiratory season. And so when there is confusion at a national level, it just trickles down and makes it much harder for us to be able to provide clear guidance for providers, for Vermonters. And that is exactly what we want to do. That's our role. And so when there is confusion at a national level, it's more important than ever that your local public health department, that your state public health department is here for you, and we are working for all Vermonters.
We received a lot of questions ahead of today's show with people wondering about the timing of when to get the COVID vaccine. And I won't go into all the details of those requests right now. But Dr. Lahey, I do wonder what you advise folks who want to get the COVID vaccine at some point this fall or winter and want to figure out like when exactly they'll have maximum protection. What do you say to them?
I think the most important thing is to make sure that you're up to date on your vaccine. So if you're over 65 or immune compromised especially, but really anybody over 6 months of age, it's good to make sure that you have at least one a year, and your primary care clinician or other clinicians can guide you on the details. Then we also talk about when it's most effective to get it done, and certainly doing at least a couple of weeks before the latest peak is nice. But I do think that that's becoming less and less important to worry about as the size of the peaks drop. I would just sort of say if you haven't had it a year, go ahead and make no urgent plans to get it, but make plans to get it. And if you're immune compromised or over 65, talk with your doctor if you need it more than once a year.
Does the Department of Health echo that advice?
Yes.
Yeah. We got a question from a listener named Judson, who's in Bristol. They say they're 51 years old, they have mild asthma, and have elderly parents, but none of those are on the CDC's list of reasons to get vaccinated. Their first question is, will Vermont follow New York with a executive order to allow anyone to get a shot, to access a shot, even if they fall outside of those CDC guidelines? Julie?
So Vermont, we really feel that any Vermonter should be able to get the vaccine when they want it, regardless of the underlying conditions. There are certain populations, as Dr. Lahey called out, that it's more important for, the over 65, people with underlying conditions, and I would say that asthma should qualify as an underlying condition. But also pregnant people, it's very important if you're pregnant or lactating, both for you yourself, but also for protection of the infant from birth to 6 months. And also for those 6 months to 2 years, which is what the American Academy of Pediatrics has also called out. So those are the ones that we think really are, as well as people who work in healthcare, healthcare providers working in nursing homes, et cetera. We are looking at what can we do to make it as streamlined and easy for Vermonters. An executive order, something else. We haven't taken anything off the table, but we really have to dig into it. There are issues of liability, insurance coverage, what pharmacies are able to do. But we are committed to finding a way through and making it as easy as possible for Vermonters.
Well, if you have questions about accessing the COVID vaccine in our region, you can call in at 800-639-2211. We have Wendy in Burlington. Wendy, what are your thoughts listening to this conversation?
Well, I wanted to thank Dr. Schuchat for her work and note that when she was in her positions of leadership, the work that she led really did flow back to Vermont through our own Vermont Public Health workforce, including, I think she visited here a number of years ago to address some of the vaccine issues. But also what she said about the CDC workforce really applies to our own public health workforce as well. I'm a pediatrician who has also done some work in public health, and I just am in awe every day of the incredible dedication and commitment of our workforce in the face of some similar challenges where funding and programs have been cut. And finally, I would just say I think we're lucky in Vermont that, and it's reflected in your two speakers today, that we have a great partnership between those who deliver health care and the public health professionals who collaborate all the time to come up with sound policy and delivery for Vermonters.
Wendy, thank you so much for calling in. And I'd love to get both of our guests' thoughts here. Wendy was bringing up our previous guest earlier in the hour, Dr. Schuchat, who is a former acting director of the Centers for Disease Control and Prevention. And we were talking about all the chaos, frankly, that's happening at the CDC right now. There have been firings of the director, a lot of people stepping down. Their immunization panel hasn't met in weeks. Dr. Lahey, how exactly does what's going on at the federal level at the CDC impact your work on the ground here in Vermont? Does it?
Yeah, it absolutely does. I think the way to think of it is that for decades, we've been able to trust that very smart, very dedicated public health workers, some of the smartest people and most dedicated people you'll ever meet, take pay cuts to work for the CDC and work for our state health department so that they can save lives. And that work has been disrupted by politicians basically acting for personal gain. And that has made it more difficult to provide excellent care for patients. We can still do it. We can change the links that we go to get good, reliable information and go to the consortia of Western states and likely soon New England states to get good information. But in the transition, I do feel a sense of loss that the United States is kind of abandoning its position as one of the foremost scientific authorities in the world. But we'll get through it. These are the, people who show up where help is needed, and they'll keep doing it, and we'll keep admiring them and following their good advice.
Yeah. And Vermont's interim health commissioner, Julie Arel, how does what's going on at the CDC affect your department's work? I'm thinking here, too, of losses of federal funding for the Vermont Department of Health. You receive a lot of grant funding from the federal government.
We do, yes. About 40% of our budget is straight federal grants, so categorical grants. So that's always a concern. I mean, every year we want to make sure that we continue to receive those federal funds to be able to serve Vermonters. This year it's been a little more up in the air. As I said earlier, we really do like to have things predictable. And so all of the uncertainty at the CDC can create a little bit of consternation at the health department. We rely, the people at the CDC, they're not just the CDC, in writ large. They're colleagues. They're often friends. They're people that we have worked with for a long time and who we place deep trust in because they are the scientists that do the research and that know what's coming. So we are feeling more, I think the health department here in Vermont really feels the burden of making sure that we are doing the best that we possibly can for Vermonters, recognizing we can't step into any gaps that may be coming out of the CDC or from the federal government, but we're going to do our best to make sure that we are guided by science and what is in the best interest of Vermonters.
During this moment of confusion, for folks listening who are, again, trying to figure out, do I go get a COVID vaccine this year? Do I take the time off of work to do that? What if it's not going to be covered? What if I'm not older than 65 or have a severe health condition? What the heck do I do? Dr. Lahey first, and then Julie, I'd love to ask you as well. Who should they ask? Who are the sources that you would say, yes, we can reliably trust these folks to get us information about this year's COVID vaccine?
I think most importantly, we want our patients to be able to trust their primary care physicians. They're the champion of their health care. And those people can be the ones to whom public health officials and others provide guidance, perhaps evolving over the coming year as this stuff gets sorted out. But I think for children, I think the AAP is trustworthy. For adults, there are other sources of good information, such as the Infectious Diseases Society of America or the World Health Association. And I suspect in the coming weeks and months, more will be put forward. And so we'll have to revisit that question here over months to come. But ask your doctor is the simple version.
And Julie, Arel.
Yes, I was Dr. Lahey really took the words right out of my mouth. We really do recommend that people, if they are confused, if they aren't sure, that they do connect with their doctor. In addition to the AAP, the American Academy of Pediatrics, we also point to ACOG, which is the American College of Obstetricians and Gynecologists. They have issued their own guidance. So there are some national organizations that can help maybe guide the way for folks and for providers. But at the end of the day, we really do feel that Vermonters should be able to make that decision either based on their own, what they feel is right for themselves or their family, or in consultation with their doctor.
Well, thank you for those resources. Those are very helpful. Lastly, Dr. Lahey, a question I have every single year around this time. When am I supposed to get my flu shot?
The highest incidence of influenza happens, in the dead of winter. And so getting it in October, November allows your immune system to get fired up in time to be maximally protected from that. So I tend to get my shot a little bit before Thanksgiving.
All right, so we'll wait a little bit on that. And then lastly for you, Julie, Arel, when is the next meeting of this consortium of northeastern states that we were talking about?
Well, we don't have any plans for an in-person meeting. Again, we do meet regularly online to talk about various issues. Right now, there's a vaccine work group that's very busy. Mm-hmm. But there are other groups that are focused on, work groups that are focused on emergency preparedness, laboratory sciences, and epidemiology. And they're all connecting to make sure that we have the connective tissues in place for when we do need to come together and really think about what can we do as a whole region and how do we move forward to protect the health of the people in our region.
Connective tissue, a very topical metaphor. Julie Arel is Vermont's interim health commissioner. Julie, thank you so much for sharing your expertise with us today.
Thank you so much for having me.
We're also joined by Dr. Tim Lahey, an infectious disease physician and professor of medical ethics at UVMMC. Dr. Lahey, thank you as always.
Thanks, Michaela.
And please be sure to join us for Vermont Edition tomorrow. We're going to be talking health, but something a little different than today. For the latest in our School Stories series, we are going to talk about sex ed. We'll hear from 2 sex educators who cover everything from crushes to consent. Plus, a reproductive health reporter with The Guardian will talk to us about threats to sex ed funding from the federal government. If you have memories from your sex ed classes, we would love to hear about them ahead of tomorrow's show. You can email Vermont Edition at vermontpublic.org. Our show today was directed by Aaliyah Papes and produced by John Ahrens. Our call screener was Kelly Delorier. I'm Michaela Lafrac. Thank you so much for listening, and we will catch up again soon.